Hey, future RN. Heart failure is one of the most tested topics on the NCLEX. In this part 1, we're focusing on understanding left-sided versus right-sided heart failure and the priority assessment findings you must recognize immediately. Welcome to ClearPath NCLEX, your go-to channel for high-yield NCLEX content that helps you pass on the first try. If you find this helpful, please go ahead and subscribe and hit that notification bell so you never miss another game-changing NCLEX. Okay, so let's get right into it. You might be wondering, why is this left versus right thing such a big deal for the NCLEX? Well, heart failure questions show up on almost every single exam. Knowing the difference between the two sides helps you spot the right complications, choose the priority action, and get those questions right every single time. It really is that crucial. So first things first, what even is heart failure? Let's keep it super simple. I want you to think of the letters HF, not just for heart failure, but for heavy fluid. Basically, the heart muscle is weak and fails to pump blood forward. This causes a backup, kind of like a traffic jam, of all this heavy fluid. And that fluid has to go somewhere. It either backs up into the lungs or into the rest of the body. Now, to absolutely crush this topic on your exam, you need a simple way to remember which path is which. So I'm going to give you a core mnemonic, a little memory trick, that's going to make this so much easier for you. Okay, here it is. This is the simple trick that's going to change the game for you. For left-sided heart failure, think L is for lungs. Simple, right? All that fluid is backing up into the lungs. And for right-sided heart failure, think R rocks the rest of the body with fluid. Let's say that again. L is for lungs, R rocks the body. Seriously, burn that into your brain. All right, let's start by digging into left-sided heart failure. And what did we just say? L is for lungs. So every single sign we're about to talk about, it all goes back to fluid building up in the lungs. Okay, so what are you going to see? Well, since there's fluid in the lungs, that's pulmonary congestion, you're going to hear crackles or rails when you listen with your stethoscope. That's literally the sound of fluid. Your patient will likely have a cough, but you have to look out for pink, frothy sputum. That is a huge red flag and a classic sign. They're also going to have dyspnea, which is just difficulty breathing, and orthopnea, which means they get short of breath when they lie down flat. And of course, with all that fluid in their lungs, their oxygen levels are going to drop. Now, there's another piece to this puzzle. Besides the fluid backing up, you also have what's called forward failure. This happens because the heart isn't pumping enough oxygen-rich blood out to the rest of the body. So you'll see signs like the patient being really tired, weak, maybe confused, and their skin might feel cool and clammy. And this part is actually pretty similar for both left and right-sided failure because in both situations, the body just isn't getting the output it needs. Okay, you're doing great. You've got the left side down pat. So now let's switch gears and look at the right side. And what's our mnemonic? That's right, R rocks the rest of the body. So if the right side of the heart is the one that's failing, that fluid backs up systemically into the body. You're going to see things like jugular vein distension or JVD. You'll literally see that big vein in their neck bulging out. You'll see peripheral edema, that classic swelling in the legs and the ankles. You might even see ascites, which is when the abdomen swells up with fluid. And here's a huge one you have to know for the NCLEX: sudden weight gain. And remember, this isn't fat, it's pure water weight from all that extra fluid. All right, this next part is so important. We are going to put everything side by side to really make the difference crystal clear. This is absolutely a must-know for the test. Let's walk through this together, nice and slow. On the left side, it's all about the lungs. So we see dyspnea, crackles, that pink frothy sputum, and low O2. Now on the right side, it rocks the body. So we see JVD, peripheral edema, ascites, and that sudden weight gain. Okay, let's repeat that one more time because it's so important. Left equals lungs, dyspnea, crackles, pink sputum. Right equals body, JVD, edema, weight gain. Remember, left hits the lungs first, right hits the rest. You've totally got this. Okay, now let's get into what the NCLEX really wants you to know. These are the red flags you cannot miss. These are the findings that mean your patient is in serious trouble and you need to act immediately. I need you to pay close attention right now. These are your act now findings. If you see them, you must act. Number 1, pink, frothy sputum. This is a medical emergency. 2, worsening crackles, especially if that O2 sat is dipping below 90%. Think ABCs. This is an airway and breathing priority. 3, sudden confusion. This is a huge red flag that the brain isn't getting enough oxygen. 4, a sudden weight gain of more than 2 to 3 pounds in a single day. That's a massive fluid shift. And 5, any new or worsening JVD and edema. These are the highest priority findings you'll see on the test. Wow, you have absorbed so much. Great job. So now let's put it to the test with a quick fire quiz to see how it's all sticking. Okay, question 1. A patient coughs up pink, frothy sputum. Is this a sign of left or right heart failure? I'll give you 5 seconds to think. The answer is left-sided heart failure. That pink, frothy sputum is that classic hallmark sign of fluid backing up directly into the lungs. Remember, this is a major priority finding. All right, next up, question 2. Your patient has jugular vein distension and 3+ edema in their legs. Which side is failing? Take a moment to think about it. And the answer is right-sided. If you got that, awesome job. JVD and that swelling in the legs are those classic signs that fluid is backing up and, you guessed it, rocking the rest of the body. Last one, and this is a priority question. Which is the most urgent finding to report? Is it A, ascites, or B, crackles throughout the lungs? What do you think? The answer is B, crackles. And why is that? Because you always follow your ABCs: airway, breathing, circulation. Widespread crackles is a major breathing problem, and that will always take priority over a circulation issue like ascites. And that's a wrap on part 1. I know this is a lot, but you've got this. Keep going, you are doing great. We've covered the essential signs for left versus right heart failure and those absolute priority red flags. Part 2 is coming soon, and we'll dive into all the medications, interventions, and patient teaching. So drop a comment below and let me know, which heart failure sign do you always mix up? I read every single one. You're doing great. Keep going. If this helped, please give it a like, subscribe, and I will see you in part 2.